The hair restoration protocol is a combined approach to treating hair loss and restoring the growth of your hair. That takes in 4 key components. First, a mechanical component, so ensuring that you're using something to stimulate the growth of your hair and improve blood flow to the scalp, which for us, we utilize a microneedling device because it's low risk, low in discomfort, doesn't cause much discomfort to the patient, it causes no damage to the hair follicle, and it's a quick and easy way to stimulate blood flow, and with blood flow, stem cells and healing cells to the scalp. So that's the mechanical component. There's the topical component. So the topical component to the hair restoration protocol is where we customize the most suitable ingredients for the individual for them to use ongoing. And when I say ongoing, it's to say that you do have to do something on an ongoing basis to improve the health of your hair. Just like if you were wanting to maintain an exercise program, you can't expect to do exercise once a month and maintain best results. Your hair is the same. So you do have to do something ongoing. So whilst we know that, we've done everything we can to minimize just how much you have to do on an ongoing basis. So what maintenance looks like for us, literally spreading a topical solution on your scalp once a day and massaging it in. What we also then encourage is that you use a provided dermal roller. Again, going back to the mechanical component, you use a dermal roller 2 to 3 times a week, which will improve penetration of the topical solution, and it will also stimulate blood flow and the benefits of stem cells and growth factors that are already in your body to head up to the scalp. The other 2 components is pharmacological. There are so many great pharmacological agents which are safe and effective for use in hair growth and hair restoration. Some of these agents get a bad name, they get a bad rap in the media. So that's really important to say that any pharmacological agents we use for an individual is suitable for that individual's preferences. So if someone, for instance, is in their baby making years and they will want to avoid DHT blockers, well, then we avoid DHT blockers. We can put into our topical formulas whatever the individual feels comfortable with. And that gives the power back to the individual. We're not a one-trick pony. So if the individual wants to go down an organic route, well, we go down an organic route. We talk about the potential efficacy and the potential benefits of using organics versus other agents. And then we talk about how it may well work for that individual. And then we make decisions collectively. We make decisions together with medical guidance, but ultimately with the decision-making power given to the patient. Then the final component to this is supplemental. So our earth no longer produces food that is as nutrient rich as it was 10 years ago. So it's common knowledge that the soil is sick, unfortunately. It's also relatively common knowledge that a lot of our food is processed. So what that means is that we're getting less nutrients in our food that leads to better hair growth on our head. Our hair is the second most metabolically active tissue in our system. So it chews up resources. So therefore, if we don't have enough resources, if our diet isn't nutrient rich, you're not putting the right building blocks into the system, your body's going to start deprioritizing your hair, and it will start to become scarce. You'll start to not have as much of the hair because your body can't keep up with the demands that your hair has on the system. So we really like to put patients on a compounded supplement which ensures you have all the right micronutrients in your diet, which enables you to build hair ongoing. So that's the HRP process. It's a combination of 4 different things. There's 4 different factors, or there's 4 different components to HRP, and those are designed around the individual. There's the mechanical treatment, there's the topical component, there's the pharmacological component, and then there's the supplemental component. Putting those together is what enables us to address the cause, the underlying cause of hair loss, and then it enables us to give great symptomatic treatments. So actually treating the problem at the level of the hair to make sure that your hair looks fuller, it falls out less, make sure it's thicker, and it's a nice rich color, but then also making sure that the underlying cause, which is leading to the hair loss, is minimized as best we can.